Namaskar. I am Dr. Namita Singh, consultant psychologist at Apollo Hospitals. Today, I'm going to be talking about depression. Depression is a very common, often underestimated and unrecognized mental mood disorder which affects the overall functioning of any individual and society in the whole. What is depression? Depression is a common mental health disorder condition in which an individual feels low, lack of motivation and feels incapacity to deal with normal day-to-day activities, which can be going to school, facing an office meeting, or for a lady to keep on doing her household chores. It can affect any age group individual at any given time. What are the causes of depression? Changes in the basic molecules of the brain, which we call the neurotransmitters. It can be an genetic impact, changes in the gene system. It can be social upbringing, social conditions. It can be poverty. It can be family impact of some dysregulated behaviors. So every individual will not have the same cause effect, but poverty, deprivation, early age child abuse, whether in terms of domestic violence, exposure by the parents, or a child sexual abuse, can be a precipitating cause of depression in the long term in later life. What are the signs, symptoms, or course of depression as such? Symptoms can be lack of motivation, feeling low, having decreased or increased appetite, sleep problems. Some individuals oversleep. There are patients who sleep for 14 hours and still get up tired and restless. Some people wake up at 3 o'clock and 4 o'clock and then can't go back to sleep because the negativity or the negative thought process is making them feel restless. Some individuals have difficulty in falling asleep. Some people may have slept for about good 7-8 hours, but when they wake, they say the mind is still very foggy or clogged. Some symptoms include lack of interest in general activities of daily life. So in an individual, a teenager may be enjoying watching some adventure sport or cartoon series or some web series, but when they are depressed, all of this becomes very rudiment or very uncomfortable them. People don't want to get out of their room or office. Does depression affect different age group people? So small toddlers can also become depressed. Earlier it was thought that only people who are in the elderly age group or middle adulthood will have depression. But now a lot of evident research clinically has proved that children of 5 to 7 years can also be depressed. In today's time, many young teenagers between the age group of 8 to 14, 8 to 17 have been found to be having active depression symptoms. Why do women get into depression after the delivery of a baby? There are huge changes in a woman's body during the pregnancy stage as well after the birth or the delivery of the baby. And these changes, hormonal changes, neurobiological, neurochemical changes are triggered in the brain as well as in the ovaries. Due to these immense change and a lot of different statushood of the parenting, caregiving scenario, many women do get into postpartum depression. It has been seen in lots of studies that women who do not have adequate emotional support from the spouse or the family who have excessive workload or who have themselves had a neglected, emotionally disconnected childhood and teenager, who are not prepared for parenting skills, often fall into the range of postpartum depression. What are the treatment options available for depression? In today's time, there are multiple approaches to dealing with depression. Right from psychiatric care, through medication, psychological support, through psychotherapy, counseling strategies, and self-help groups. It all lies in simple understanding and acceptance towards the condition. So I would like to break down depression into a very simplified form. And I have made an acronym using the word depression. I would like people to understand and remember it forever, as we have remembered our times table from class 2. First one is deep breathing. Deep breathing is one of the best exercises which has clinically and scientifically been proven to help the reverse the neural chemicals molecules. Meditation, it doesn't just relate to religious meditation, but enjoying the calm of your mind to do things which you enjoy. Positive hobbies, positive affirmation. In the lifespan of a child, a young adult or elderly, there have been some good events and some bad events. We need to bring into our memory the positive affirmations, feeling good about yourself, remembering those good achievements which one has made in due course of lifetime. As simple as sewing, knitting, painting, baking a cake, or doing some normal cooking, going for a cycle ride, going for a walk, getting into a park or some green area. These all help in getting out of the mental state of feeling low, as what we call depression. Nutrition. Many of us ignore our food intake. The brain, mind and body is interconnected. So whatever you put inside your body will affect your brain condition. When I say brain condition, the neurochemicals are made through the food and quality of nutrition we give to our body. So it is very imperative and important that we eat adequate amounts of fruits, we drink lots of fresh water, we do not overload ourselves with caffeine or nicotine or any other kind of substance. It is important with these basic few constructs, we can come out of depression, and there is always help available through professional guidance and medication, psychotherapy, counseling to overcome depression. Thank you. Keep well and stay well in life. Wishing you all goodness.